Hi, everybody. This is Dave Gold from Crossroads Psychological Associates. I'm a psychologist here in Columbia, Maryland, and I'm here with my partner, Matt Otto. Hey, Matt.
Hey, good to see you, Dave.
We were thinking that today we could talk a little bit more about what's been going on in our practice in the world of therapy during the pandemic.
Absolutely. It's been a crazy time for everybody.
Yes, it has been. Yes, it has. Did you say that one on purpose?
Absolutely. No, because there's no normal right now, right? Um, what we have all tried to do in our lives and with our routine and with our jobs and everything else, it's all up in the air right now. Heck, even you and I, we've talked about doing this kind of web series for a long time and wanted to do it in the office, and here we are having to do it via Zoom and with two separate screens. And so even this little thing isn't normal. We're trying to do our best to make it normal.
The best analogy I've heard from one of my patients is we're building the plane as we're flying in it.
That's about right. I
Yeah.
feel so sorry, especially for other folks, especially teachers. These teachers who are
Oh
all
my
trying
gosh.
to learn how to do online school and convert their curriculum all at the same time. I mean, maybe I'm a little more sympathetic to it because my wife's a teacher, but holy cow, the amount of information that she's been taking in over the last few days trying to get this up and running is absolutely insane.
And you can say that again. In a lot of ways, we're really lucky that we're able to do teletherapy the way we are. And really the therapy that we're doing in our practice lends itself pretty well to transitioning to this kind of platform.
Yeah, it really does. But it certainly hasn't been without its challenges, and some of the things that people are dealing with right now. We're not used to dealing with those either. So it's hard. We're all in crisis. I know one of the issues I've had over the last couple of weeks is people start saying, I've had to deal with this and I've had to deal with that. And I want to jump right in and be like, yeah, and I've had to do this and I've had to do that. And I've had to stop myself and go, okay, wait, hold on. This is their time and their space, and I need to let them have their time to fall apart in session or deal with whatever it is they're dealing with.
Have you been having a lot of patients kind of quote unquote fall apart? Because I just look at my whole caseload and it seems like everyone is under just a huge amount of pressure. The anxiety is just spiking.
Yeah, absolutely. I've had more crisis calls from parents over the last 2 weeks than I can ever think of in a 2 week period in my career. A lot of them are from people who, from kids especially, who really need normalcy, right? And so the ones that I've seen especially are kids who are working through trauma and kids who are on the spectrum. Those kids who really need normalcy, who right now just have no idea how to handle themselves and are falling back into old habits that they've been working hard to get out of over the last few months, and they don't know what to do with themselves right now.
Right. It's well, kids, teenagers, and also parents.
Right.
We don't know what to expect, and that's the most frightening thing is the unknown.
Mm-hmm.
And when we don't know what's coming up and we don't know what's around the next corner, that's real disconcerting for a lot of us. We got to just go back to, the things that are consistent that we can depend on, the people in our lives, our support systems, the fact that even though it's a crazy time, we don't have to get through it alone. We can get through this together.
Right. But also trying to create a sense of normalcy for ourselves in the middle of it, making schedules, scheduling time to do things like exercise and having brain time or screen time, educational information, time with family, doing games, whatever that structure is that works for your family, trying to create it for yourself, put it on the refrigerator, whatever works for you guys. We've been sending our kids outside and doing yard work together. We've got this one project that I didn't think we'd get done in like the next 5 years, and we're almost done it. I mean, thank the pandemic for that. So there are some good things, but trying to create some sort of rhythm and schedule in the midst of this crazy to help those especially vulnerable folks who are having a hard time right now.
I think that's very well said. I think that's very well said. The only thing I would add is it's normal to feel a little out of control and to
Hmm.
feel some anxiety. That doesn't have to be looked at something that's, pathological, or there's something wrong with you if you're feeling stressed at this point. Unfortunately, anxiety, to an extent is the right reaction to what's going on.
Right. Yeah, this isn't a time when this is real anxiety, right? It's not
Yeah,
like some of our patients who deal with an anxiety disorder where they don't necessarily have something that they should be anxious about. Their brain just cranks it up to 11. No, we're all cranked up to 11 right now, and appropriately so.
when the lion is charging at you, that's the wrong time to say, okay, let's calm down and try to talk about this.
Right. Yeah, we need some of this anxiety to give us the motivation to keep going, to figure out what's next, to figure out how to work through this, right?
Right,
If we didn't
right.
have that anxiety, we'd all be kind of stuck and just sitting around watching TV and waiting for this to pass, and watching as our bank accounts dwindle down to zero, and whatever, we run out of toilet paper.
My lion is now charging at me. So we've been doing everything online. We've been doing this teletherapy.
Right.
How's that been going for you?
I've really been enjoying it in general. It's not perfect. I would say that I still prefer meeting with people in person. There's something about getting the nonverbals in person of how they react. You can get a decent idea of their facial expressions, but the other nonverbals you miss, and there is just something really comforting about being with someone in person, and so you miss some of that. But all that being said, in general, most of my patients are responding really well to it. They seem to appreciate that we're offering it. It adds some extra structure to the schedule because I'm having to send out invites for all of the appointments. So I've actually had less cancellations over the last couple of weeks because of that. So there's some benefits to it as well. And you and I work a lot with young adults and teenagers. They do really well with it. I've actually been really impressed with some of my sessions with teenagers because they're so used to communicating with their friends in
Yeah,
that kind of a
absolutely.
format. I've got a young adult and a teenage group that I do, and those have been great because there's already this kind of ethic around those group chats that they are already doing while they're playing video games and other things. I don't have to tell them to mute their mic when they start doing something else in the room, or when they're about to sneeze. They all do it automatically, and that's something that those of us old folks don't. It doesn't come naturally to us. And so when we're in our staff meeting or when I'm doing chat with my family, it's like we're all talking over each other and no one can really hear each other. And teenagers and young adults, they know not to talk over each other. They know to look for when this person's talking, and they don't cut each other off. In some ways, they're more socially appropriate in this setting than they are in the office.
Most of my teenage patients are more socially appropriate than my family anyway. So how many of your patients have asked you to stand up just to make sure that you weren't wearing sweats or pajamas bottoms?
None yet. I have to admit that's another thing I've actually enjoyed about this. I'm wearing pants now, but I had a big break in my schedule the other day, and so I wore my workout clothes under my work shirt and did my first session, went and worked out, and then took a shower and put on appropriate clothes and came back into the rest of them. So that's been a nice thing. I also have a pair of shoes I really like. They're blue suede. They make me feel like Elvis. And I can't wear those to the office, so I've been wearing those on a regular basis.
You
How about
realize
you?
there's no expectation of confidentiality in this video.
Okay, I guess I'll have to cope. Well, and for some reason, you're speaking of what we're wearing. this is the second video in a row, I don't know if you've noticed, where we've pretty much worn the same thing. That we have not coordinated that at all. It's just kind of happened when we've gotten on the screen.
I've had a lot of patients ask, we're using Zoom. This is the platform we use in our office is Zoom. And a lot of people have asked me about how safe it is and the confidentiality with Zoom. We're using a HIPAA compliant version of Zoom, so it's not kind of just the base level of it. And we do a couple of other things to help. Nothing is foolproof, but to help augment the security a little bit. We send out different invitations for each session. It's not that we just kind of have one code for one Zoom room that anyone who has the code can get into. It's a different code for each session. We also use the waiting room feature on it. So before someone can actually join into one of our Zoom sessions, we get a little notification that someone's waiting and we have to actually allow them in. So that helps it a little bit. Nothing's foolproof, but so far I haven't had any problems security-wise or confidentiality-wise. Have you heard of anything?
No, not with my clients. I did have my son give us a hard time in an extended family meeting that we did last weekend. but nothing with my clients. That's all been fine. I think you're right. The combination of the waiting room and it being encrypted and having separate IDs for each meeting makes it a whole lot harder. Like you said, nothing's foolproof. Even some of the therapy and specific apps that are out there, nothing's foolproof. As we've looked around for advice and as we've shopped around, because we looked at a number of different platforms before we decided on Zoom. And what we learned is that nothing is foolproof. There's always workarounds if someone is really intent on getting into something. But you certainly, if you are considering doing telehealth as a patient or client, ask your provider what it is that they use and why they use it and how secure it is before you would get into it.
And if you really don't feel comfortable with anything online, I have one patient where I'm just doing old-fashioned sessions over the phone.
Yeah, that's been one great thing. Most states have suspended some of those telehealth rules. So we're in Maryland, and Maryland has suspended the telehealth rules requiring a HIPAA compliant encryption. We're still doing it because it's best practice, but a lot of folks are now able to use FaceTime or the phone and get insurance reimbursement for that during the duration of this pandemic.
Good point. Very good point.
You know, the other thing is, go ahead.
No, after you.
The other thing is a lot of your clinicians, if you're in a session, are going to ask you just to make sure you're in a quiet place, that you're in a private place, that the door is closed, that no one else is around. First, it can be really distracting in session. I've had this happen a couple times, to have a parent in the room going, and talk about this, and talk about that. But also as a client, you want to be able to say things to your therapist that maybe their parents or their spouse or whoever aren't going to hear. So that's good, important.
Yeah, and I think most people understand that it's still therapy and it should be confidential. Sometimes they just need a reminder, but that's a good point. If you could make sure to do the teletherapy session in a room with a door as opposed to kind of the middle of the living room where you have everybody walking through.
Right.
Although I've had more sessions with dogs in the sessions, which I'm fine with.
My dog's been joining me for sessions. This office here is normally, he's got a dog bed in the corner that you can't see right now. But when we would go to school and work, he would crash on that dog bed because our front door is on the other side of this door, and he would wait there for us to come home. So he's used to hanging out in this room. So he comes and joins me for a bunch of sessions. He promises to keep everything confidential.
Does he get a cut of the fee?
I give him an extra dog treat.
Matt, it was good talking with you again about this. I guess
yeah,
we'll come
likewise.
back next week with another edition.
Absolutely. Yeah. Thank you, everyone, for listening, and we will see you next time.
Take care, everybody. Stay safe.